Welcome to Let's Move Cities, Towns, and Counties. We're your hosts,
Ariel Austin,
Jasmine Lewis,
and Alexis McGee.
We hope you're ready for our evaluation plan.
Let's Move Cities, Towns, and Counties is a national program that was launched in 2010 by the First Lady Michelle Obama. This program was introduced to local elected officials to adopt long-term, sustainable, and holistic approaches through the 5 goals designed to improve the health of children and to improve the childhood obesity epidemic nationwide. The LMCTC is a comprehensive initiative dedicated to providing children and families with the tools that they need so that children born today will grow up healthier and able to pursue their dreams. For this evaluation plan, we chose to evaluate Aurora, Connecticut, who introduced this program through their mayor, Steve Hogan.
Okay, let's talk goals. LMCTC goals were identified because they are achievable and measurable. The programs are designed to provide children with early, healthy lifestyle practices, educate the community on healthy portion sizes, provide children with healthy food options, and allow children to engage in more physical activity. The focus of the program is to have more concrete, sustainable strategies for healthy eating and active living in communities. Over 500 sites have committed to the goals of Let's Move Cities, Towns, and Counties, and nearly 100 cities, towns, and counties have reached the highest level of achievement. But as previously mentioned, we'll be evaluating the city of Aurora, Connecticut.
Okay, great. On to objectives. For our formative objective, we stated by the commencement of the program, all child care providers implementing Let's Move Cities, Towns, and Counties should be trained on nutrition, physical activity, and screen time intervention methods. The objective was chosen to ensure all child care facilities and facilitators are properly trained on the appropriate intervention methods. For our process objective, we stated during the program, all students will be allowed 90 minutes of daily outside playtime. Through this evaluation, we want to ensure that all activities being conducted are appropriate for the population and feasible for the child care facilities who are implementing these programs. This includes making sure all spaces and materials for this intervention are being used efficiently.
The impact objective is the immediate result of the program. Therefore, by the end of the program, we expect that 30% of children enrolled in the Let's Move Cities, Towns, and Counties program will be able to recognize more nutritious food options. Although this program focuses on screen time, nutrition, and physical activity, we found that nutrition would be the most appropriate aspect of the program to measure at this point in order to test for the knowledge gained and the attitudes changed as a response to the program in Aurora, Connecticut. On to our last objective. 6 months following this program, we expect that 40% of households involved will see decreases in the total screen time used and increases in nutritional intake and physical activity levels. Therefore, the activities and practices learned from this program should be implemented within the household. Stakeholders involved with this program want to ensure that this intervention will also positively impact the screen time, nutrition, and physical activity practices of all members of the families involved in their program.
Shown above is the logic model formulated for the Let's Move Cities, Towns, and Counties program for the city of Aurora, Connecticut. Take a few moments to read over some of the key aspects of this model, including the activities and outcomes. The logic model for this program was drafted with the help of stakeholders involved in this program. This includes the local elected officials, the mayor, Steve Hogan, the child care facility employees, and the parents of the children involved in the program. The logic model will be used as a guide for our evaluation process.
These are the questions we chose for the evaluation process. For formative evaluation, we will be asking, were the implementers or teachers properly trained on the curriculum? What materials will be used to complete the nutrition and physical activity, as well as reduction of screen time activities? Are the materials used to address nutrition, physical activity, and screen time feasible for the target population? For the process of evaluation, we will be asking, when did the nutrition, physical activity, and screen time reduction activities take place? What were the barriers and facilitators to teaching nutrition, performing the physical activity, and reducing the screen time among your population? And is the program reaching the intended target population? For impact evaluation, we will be asking, did the implementation of a nutrition activity in the early child care facility result in changes in knowledge and attitude of healthy foods among the target population? Did the benefits of physical activity justify a continued allocation of resources? And what unintended benefit came from the reduction of screen time? For outcome evaluation, we will be asking, to what extent did the nutrition activity have on the nutrition practices of the early child care facility? Did the physical activity program facilitate an increase in daily exercise in the target population? And did parent involvement in reduction of screen time yield in a positive outcome?
Shown above is the evaluation timeline that will be used for this program. The first step is to engage the stakeholders. In order to do that, we're going to discuss with them what questions need to be asked, what parts of the program need to be evaluated, and in what ways we can involve other stakeholders in this program evaluation. The second step is the description of the program. So we'll work closely with the stakeholders to produce a program logic model, as well as describing in depth those parts of the program that need to be evaluated. This will introduce us to the third step of our timeline, so that's the evaluation design. During this time, we're going to create the instrumentation that will be used during each part of the program evaluation and what methodologies need to be used as well. And we'll discuss these a little bit further eventually in the presentation. The fourth step is to gather evidence. So we will conduct focus groups, surveys, and interviews of those involved in the evaluation and in the program, in other words, the stakeholders. And then that'll bring us to the very last step of our timeline. So reporting the findings to the stakeholders and to the public. To do this, we'll meet with the stakeholders and first discuss the findings of the program and come to an agreement on the ways that this program can be improved in the future. And then we'll figure out what ways we would like to disseminate the knowledge to both the community members and the stakeholders, and even those that would like to implement similar programs to cities that have similar populations as the one that we chose. This evaluation timeline goes into depth of the different actions that will be taken throughout each part of the evaluation plan. The formative, process, impact, and outcome evaluation activities are all mentioned here.
A mixed methods approach will be used to evaluate the LMCTC program to allow for an in-depth understanding of the program's success or hindrance. Surveys and image-based surveys will be used for parents and children respectively. Surveys will allow for the collection of data from large numbers, such as the collection from both parents and every child in the classroom. Surveys will be given to the parents to collect quantitative data relating to the time spent on nutrition, physical activity, and screen time at home. Focus groups will be done for providers, and the focus groups will allow for qualitative data collection, allowing an in-depth response about how well the children are grasping concepts and participating in the program.
Information that will be shared from this evaluation includes the evaluation findings, suggestions for improvement for this specific program, and what to expect with continued use of the program. Those who will be shared this information will be the child care facilities that are involved in the program, parents of the children of these facilities, the community members in this area, and the school board of Aurora, Connecticut. This information will be disseminated through press releases to the local news stations, newsletters that are sent out to parents and those involved in the school system. A written detailed summary will be shared with the stakeholders, and the stakeholders can use this written summary and any other information from the program within meetings to share the information with the school board. As mentioned before, the stakeholders will be heavily involved in this evaluation plan. First, they will be included in creating the logic model during the formative process of this evaluation. They will also help create the instrumentation for children methods, or the methods that are going to be used to evaluate the children. And then lastly, they'll be involved by coming up with new ideas to disseminate the knowledge that has been gained from this program.
As program evaluators, we've come up with 3 main challenges that may arise during this process. The first one being stakeholder participation. It may be difficult to have active participation from all stakeholders. Another challenge may be disagreements among stakeholders regarding the results and findings. Some stakeholders may disagree with the findings of this evaluation. And the third one is results and findings may not be generalizable. Due to the specific location, access to resource, and population chosen, the results of this program may not represent the entire country.
Here are some solutions to our evaluation challenges. So firstly, we'd like to involve the stakeholders in the planning from the beginning of the process and to provide them with similar successful programs. Secondly, we'd like to express the relativity of our programs to individual stakeholders. And lastly, we'd like to use our results and findings as a guide for future programs in other communities. Thank you for watching our evaluation plan.
Our resources are listed below.
Bye. Bye.